What is a DO? That's a question I get often, and I don't always have the most time to answer it, so I thought I'd make a video with kind of the long version. But a DO is a fully licensed physician or doctor. We can prescribe medications, we can practice in almost every specialty, we can practice in all 50 states, and we can practice in over 65 countries. So we are fully licensed doctors. We are not naturopaths. Naturopaths cannot always prescribe medications. They typically use more supplements, nutrients, things like that to treat conditions. We are not necessarily functional medicine trained, so there is kind of a subspecialty called functional medicine that focuses on identifying the root cause of an illness and focusing on like lifestyle modifications, dietary modifications, things like that to address a condition. There are DOs, NPs, and MDs who are all trained in functional medicine, so we're not necessarily interchangeable, but that is something that we get confused for a lot. So a lot of people are like, okay, well, if you're just a fully licensed doctor, it's kind of the same as an MD, like what's the difference? And that can kind of be true. It depends, I guess, on your practice, but DOs are trained in additional therapies and techniques during our medical training called osteopathic manipulative therapy or osteopathic manipulative medicine. So we'll get into that a little bit later on, but I think there's important history and foundational principles of osteopathic medicine that I wasn't necessarily aware of before becoming a DO, and I think that they're helpful for people to know if they're considering the profession or if they're even considering like what kind of healthcare provider they want to see. So Andrew Taylor Still, A.T. Still, was the founder of osteopathic medicine. He was an MD. He was raised by his father, who was a preacher and a physician, and he then went to the Civil War. He was a physician. He had children. He just decided at that time that the treatment options were very limited and were often potentially very harmful. This was back in the 19th century, so they were still using like mercury and opium, and there weren't a lot of antibiotic therapies or so. Back then, he decided to develop some techniques and developed the profession of osteopathic manipulative medicine, or osteopathy, or OMT, or osteopathic medicine. He did eventually go on to start the first osteopathic medical school. So he's, the founder of our profession, and we appreciate that and recognize that all the time. But another big piece is our osteopathic tenets. So basically, these are the principles that the AOA came up and said, like, this is what sets us apart, this is our foundation. So the osteopathic tenets are that we see the body, mind, and spirit as a unit. We believe that the body is capable of self-regulation and self-healing. So if you have an illness, an injury, or a condition, the body naturally wants to heal itself. And then we also believe that structure and function are interrelated. So like the anatomy and physiology are interrelated. And then we believe that best practice of medicine acknowledges all of these things, treats the body, mind, and spirit as one unit, treats the body as it wants to heal itself and regulate itself, and uses structure and function to treat the body. So those are the main osteopathic tenets or principles that we use. So the thing that we are trained in, a little bit different than MDs, is we are trained, like I said, in osteopathic manipulative therapy. We have to take a course the first 2 years, at least at my university, and I think most osteopathic medical schools have to do this, but you have to take OMT, and you learn the different techniques and the different modalities of OMT so that you have this extra tool to treat your patients. So some of them include counter strain, balanced ligamentous tension, facilitated positional release, muscle energy, high velocity, low amplitude. So that's kind of like what you would think of when you go to the chiropractor, like the popping, cracking, things like that. And then soft tissue, which is kind of more similar to like massage therapy. A lot of our techniques are pretty similar to like PT or OT if you've ever done anything like that, but they're more like hands-on manipulative techniques to either heal pain or just like help a patient heal or recover from whatever condition they're having. So that's some background on OMT and osteopathy as a whole. I even went a little bit into HE Still's background and history, which I do think is really important. But I hope that's helpful. I hope that gave you kind of a good background information on what a DO is, how we're slightly different, our basic foundations and principles. And if you have more questions, let me know.